Good evening to all our viewers. Thank you for joining us. On behalf of Nash 24/7, I welcome you all to today's Facebook Live program on non alcoholic fatty liver disease. Today, we have with us eminent gastroenterologist and hepatologist Dr. Thamarai Selvan. Dr. Selvan is currently associated with prestigious SRMC College and Medical College and Hospital Chennai as assistant professor and senior consultant in hepatology and gastroenterology. Dr. Selvan carries rich experience in the field of gastroenterology and hepatology. He has been part of various research projects and has numerous publications on his name. Sir, it's our privilege to have you with us today. With this, I would like to request Dr. Thamarai Selvan to enlighten us on current epidemic of non-alcoholic fatty liver disease. Over to you, sir.
Uh, thank, thank you very much, Akash. Good evening to everybody. So I welcome you all to this program, Fatty Liver. So as all of you know, the liver is a major organ. It is almost weighing about 1.5 kilogram. It is the largest organ in the body, and it is had it does numerous function, and so the healthy liver is normally a reddish brown in color, and its surface is very smooth and borders are sharp. So the liver is a big factory. Actually, it does a lot of function and mostly concerned with the metabolic functions, and performs over 500 functions. So it acts as a big factory as well as filters bacteria and so many functions, except especially synthetic function, that is a synthesis of clotting factors and various lipoproteins and various proteins in the body. And it is an excretory function. It excretes this bilirubin, and it has a storage function and storage glycogen and vitamin A, glucose in the form of glycogen, fat, so it stores. And there's also detoxification function. Detoxification function is makes the drugs metabolize the drug and drug metabolize into non-toxic substances, and it is excreted through the bile. So it almost control all the metabolic functions of the body. It is concerned with the carbohydrate metabolism, protein metabolism, fat metabolism. So, and it is in fetus, it is produces RBCs also, as well as this destroys the RBCs. And it is a fetus, it is a hematopoietic organ. It's a acts as hematopoietic organ. And in certain conditions, when the other hematopoietic organs fail, liver, it is the extramedullary hematopoiesis occurs in the liver. So it is almost does so many metabolic functions. Next slide. So what things can damage to the liver? So normal liver is a very huge capacity. So almost when our symptoms, 90% of the liver is damaged, then only the symptoms occurs. And common causes that affects the liver is alcohol. So alcohol is a hepatotoxic and toxin. Then comes this hepatitis viruses, B and C, obese, and it is obesity. Nowadays, it is becoming epidemic proportions, and it's a fatty liver and associated NASH and cirrhosis. And tobacco acts as a cofactor. Smoking acts as a cofactor. So it is the major causes there. The other can some genetic disorders and drugs can damage the liver and so on. So today's topic is non-alcoholic fatty liver disease. By definition, it is the liver accumulates excess fat that is not related to significant alcohol intake. That is less than 30 grams per day in men and 30 grams per day in women. That is excess fat is more than 5%, and this you have to rule out the secondary cause, then we can define this non-alcoholic fatty liver. So what is the incidence? Incident is nowadays it is occurs in an epidemic proportion, and it's Indian and South Asian countries. There is a increasing incidence of this non-alcoholic fatty liver, and it is one of the common liver disorders nowadays. So almost it is a 25%, 1 in 4 people is having NFLD, and 25% goes in for now non-alcoholic steatohepatitis. So globally, it is becoming obesity is becoming epidemic, and more and more people are becoming obese. So the prevalence of NFLD is also increasing. Next slide. So non-alcoholic fatty liver disease is associated with the risk factors. Obesity comes first as a major risk factors, and type 2 diabetes mellitus is another major risk factors, which is very increasing incidence. And other risk factors are these hypertension and high triglycerides, and high cholesterol, high sugary foods, and polycystic ovarian syndrome, hypothyroidism is also a risk factors for this NFLD. Next slide. And obesity is an important risk factor, and there's a type 2 diabetes mellitus is also almost 70% of the type 2 diabetes having NFLD, and 90% of obese people associated with the NFLD. And what are the symptoms of non-alcoholic fatty liver? Mostly it is asymptomatic. So people doesn't have any symptoms, and it is picked up by screening methods, or it is specifically the physicians look for it, they can pick up the fatty liver. However, some people experience these type of symptoms, and common symptoms is dull aching, right abdominal quadrant pain, and it is where excessive fatigue, nausea, vomiting, and in NASH, cirrhosis, they go jaundice, and dark urine associated with dark urine. Sometimes if they go for a associated cholestasis, they'll have a pale stools, and if there is go for a complication, they have like easy bruising, and it is ecchymosis like, and in cirrhosis, patient tend to lose weight loss is occurs. So this important question comes: how do I know if I have NFLD? So nowadays, there is a lot of screening tests, and easy available tests are available. And most of the cases are picked up by the abnormal liver enzyme during routine screening. So they screen for other purposes, the time that is the elevation of the AST and the ALT, and they referred for evaluation. Most of them are found to have fatty liver. And also it is ultrasound is a cheap, easily available, non-invasive screening tool, and most of the NFLD patients are picked up by the sonologists. They said bright liver, and it is increased echotexture, is considered fatty liver. They'll give the report like it. And nowadays, the latest scan, that is specifically the specialist refer for the FibroScan. The FibroScan gives this liver stiffness and this CAP score, that is ultrasound attenuation parameter, which picks up the level of fat in the liver. And by this screening test, we can diagnose NFLD. And clinically, very rarely pick up NFLD, but obesity and metabolic disturbances is associated with metabolic syndrome, whether the hypertriglyceridemia, hypertension, impact fasting glucose, the waist circumference.
then we can suspect NFLD, and some non-invasive scoring systems are available like fatty liver index and NFLD score. By that, we can suspect and evaluate for them to pick up fatty liver, mainly through ultrasound or fibroscan. Very high-end tests are available like MRI, CT scan. That's also, it is a routine. They, they did for other purposes. We can pick up fatty liver from those investigations. Next slide. So NFLD is how to manage NFLD. So why we have to manage NFLD? Because NFLD is not a benign disease as once thought, because some proportions go for inflammation in the form of hepatocyte injury, ballooning, and followed by healing response and remodeling and fibrosis, going for cirrhosis and end-stage liver failure. Even hepatocellular carcinoma can occur in a very few percentage of people. So with the associated liver morbidity and liver-related complication, we have to pick up NFLD, aggressively look for NFLD, and manage them. So the management of the NFLD, there is a very few pharmacotherapy and other options are available. So the basic main treatment rests on this lifestyle modification and so weight loss, cut down alcohol, and these are the main things where the management of the NFLD is mainly it is based on. So we have to do this physical activity, encourage physical activity, and this is the dietary modifications. So would weight loss really helps in NFLD? Certainly. Certainly, that is a amount of weight loss is it is related linearly to this improvement in the liver-related events. So even 3% of weight loss is helpful to reduce the steatosis. Almost it is 40 to 100% of patients, the steatosis score has been come down, the steatosis amount comes down, and weight loss 5 to 7%, there is a definite improvement in ballooning and inflammation and hepatocyte associated hepatocyte injury, which is the future forerunner for fibrosis, and it is liver-related complications, cirrhosis and its complications. And weight loss more than 10% can help to reduce even fibrosis, which is a very difficult thing to achieve the regression of fibrosis. So the weight loss, aggressive weight loss more than 10% is helps in fibrosis regression also. So we have the lifestyle modification. So now the modern day is a sedentary lifestyle, and it is increasing, and people are do less work and eat more. So a lot of calories, they consume a lot of calories, and it is a fast food and other culture. It's a modern day culture has increased, prone to get this in non-alcoholic fatty liver disease. So the healthy habits like do a balanced diet rich in vegetables, fruits, and other pulses, legumes, and cut down the red meat and high calorie fatty food, oil, and do some dynamic aerobic exercises like cycling and biking and swimming and walking briskly, whether some playing tennis or the shuttle. So the bad habits, as I said, it is the fast food culture. It is increasing caloric and sedentary life. This is so watching TV all the time, sitting and not walking, and most of the time it is using not using this walking as a mode of transport and using car and other comfortable mode of transport. So it increases the chance of getting a fatty liver.
So you have to concern about the balancing your calorie intake, and the intake must be cut down and this output must increase. So you have to look the food rich in calorie, you have to cut down, and the beverages rich in sugary drink, like uh, there's markedly available fruit juice, other carbonated drinks, which is containing a lot of calories, salt, and it is increases the uh, energy intake, and we have to cut down all those calorie, and we have to be conscious of that. Then we have to increase the physical activity, and by doing intense, moderate intensity work, or it is high intensity work, or even low intensity work, and we have the burnout calories, and increases the decreases the insulin sensitivity. And by doing that, there is the occurrence of future occurrence of NFLD can be reduced. So this comes this Mediterranean diet chart, and you show the pyramid. At the top of the pyramid is this high calorie food, and at the bottom line you get this food rich in low calories and rich in vitamins, minerals, and low calories. We have to increase this bottom line foods more, and we have to reduce the top end food. So this is fruits, vegetables, green leafy vegetables, and beans surface. And another second is comes is the protein, and it is the fish, the seafood, other things, or it is the. And then we have to cut down this. These are all the increased calories, eggs and the cheese, butter, and red meat, all these things. We have to reduce it. And the bottom line food we have to increase. And we should not forget about the portion also. So not only the quantity, and it is, you have to decreases the portion also. We have to cut down the portion, especially red meat and the eggs and the cheese, butter on the high calorie foods, and increases the portion of the vegetables, and stop alcohol, which is an important thing, and drink a lot of water and stop alcohol and carbonated beverages. So the exercise is an important part of the lifestyle modification. So the recommended duration of exercise is at least 150 minutes per week of moderate intensity exercise, or 75 minutes of high intensity exercise. And moderate intensity exercise is this slow jogging and in swimming and walking briskly. And low intensity work is like walking and gardening. High intensity work, whereas the metabolic equivalence is more than 7 or 9, is tennis, cycling, and running. And moderate intensity exercise will have this metabolic equivalence of 3 to 5. And so brisk walking is practically brisk walking, and gardening and cycling is the best exercise we can encourage, and people to move on the healthy lifestyle, thereby reducing the incidence of NFLD and future liver related complications. So again, it is a weight gain. It is the most important. We have to look, and consciously we have to work for it to control your weight, which is the most useful thing in this management of the NFLD. And pharmacotherapy comes to the pharmacotherapy where there are limited options, and most of the pharmacotherapy, it is requires a liver biopsy to diagnose NFLD, not only not NFLD as such, it is mainly to diagnose NASH and fibrosis. So pharmacotherapy is mostly recommended after liver biopsy to rule out other causes. And for diabetic patients, it is pioglitazone and other PPR agonist can be tried, and non-diabetic patients, vitamin E in the dose of 800 international units per day can be tried. And once cirrhosis and occurs, Then it is routine management of the end-stage liver disease and the compensated and the uncompensated liver disease that protocol should follow. And ultimately, it is a end-stage liver disease, and the patient as well with a liver failure and liver transplant is the only option. So we have to forecast this liver-related complications in future and try to prevent them. And the lifestyle modification is the weight loss and exercise and dietary modification and reduce the calorie content and reduce the portion is forms the mainstay of the treatment and cut down alcohol and other risk factors, controlling other risk factors should be done along with that. And for a very limited pharmacological option and some new drugs on the pipeline, but it is not, so still we are waiting for the uh, enhanced pharmacotherapy options. So till then, it is a lifestyle modification and weight gain is forms the basis, and it is a patients should be uh, screened, follow up, and follow up of the future liver-related incidents and fibrosis and quantification, and it is the management of the uh, and related then stage liver complication once it's occur is as per the normal thing. So these are the tips to lose weight, and so you have to, nowadays the apps are available to monitor how much walking steps can done each day. So 10,000 steps in each day and cut down into calories and look for the low fat option and meal routine, take meals at the same time of the day and use a lot of vegetables, fruits, and so you focus on the food and I don't eat on the go because you will eat more. And so things about you have to take the drinks sugar free, avoid sugar free, and drink a lot of water. And it is a low calorie drinks. And sedentary lifestyle, you avoid the sedentary lifestyles, and it's in between you up on your food and break up for late sitting time or walking around the room will help. So this is the thing of, don't forget about the five things is fruits, vegetables, and there's legumes. So thereby you have to cut down your calories and it is leading on to a healthy lifestyle. Thank you very much.
Sir, thank you for explaining us clearly on the perils of non-alcoholic fatty liver disease and how to manage. We have quite a few questions from the audience.
Okay.
First question is, what South Indian diet you recommend and is ideal for a fatty liver patient, for a grade 2 fatty liver patient?
Thank you very much. The South Indian diet, it is normally my main advice is reduce the portion. Normally you take whatever you used to take. That means if you take 5 idlis per day, reduce it to 3 idlis. Taking 3 dosas, take 2 dosas. Like so, add on vegetables. Mainly it is with that you add a cup of vegetables and it is some nuts and legumes and reduces the carbohydrate. So refined carbohydrates such as rice and potato, all these things. And reduce the portion. It is the very important thing for the South Indian diet because they used to consume a lot of carbohydrates such as rice, and so you have to reduce the portion and increases the vegetables and other pulses and reduces the meat. That also you have to reduces the portion, increase instead of you take your fish and so the egg whites. So
Okay.
so reduces the portion and there is a replacement with the vegetables and then fibers and legumes. It is most important.
Okay. Sir, second question is, I have grade 1 fatty liver. I am 34. Which dairy products can I consume?
Fatty liver, it is mainly you have to be in follow-up, but because fatty liver is grade 1 fatty liver, and you have to rule out this future liver-related events such as NASH and associated metabolic factors. So metabolic factors such as obesity, diabetes, and if it is in alcohol, we have to stop alcohol, cut down alcohol, and do regular exercise and reduce the weight. That is the most important thing for a fatty liver, as well as follow up with this ultrasound or fibroscan. It is a non-invasive, so easy to nowadays it is available, and we can follow up with that with the liver enzymes, and don't take unnecessary medicines, and avoid there is unlabeled medicines, off-label medicines, and complementary medicines or over-the-counter medicines without this physician advice. So dairy products, it is a low skimmed milk or low fat milk. It is recommended instead of taking high fat milk. And avoid cheese, butter with a high calorie food, or you reduce the portion, take little quantities, and do more exercise.
Okay, sir, I am means one viewer has asked. I am currently doing intermittent fasting. My friend recommended me that intermittent fasting can help me in overcoming fatty liver. Is it true?
Intermittent fasting is as such, it is not scientifically it is evaluated, but definitely it is reduce the calorie intake, and it is so definitely it is helping to reduce weight. But fasting for a prolonged periods, and it is associated with other complications with electrolyte imbalance and weight feeding syndrome like things. So without physician advice, you should not practice it. And instead of fasting, reduces the calorie content and reduces the portion of the food, helps, and with along with the exercise.
Sir, is fatty liver related to age? Can it happen to young people? Hello. Sir,
Hello.
I'll repeat. One viewer has asked, can fatty liver happen to young people? Is it related to age?
So age is a risk factor, but nowadays it is fatty liver can occur at any age. Even 3 months babies are reported having fatty liver, and the pediatric population it is increasing, and it is adolescent population is increasing. So mainly due to this changing and lifestyle, and it is food habits, and reduced sedentary lifestyle. It is the main social determinants of getting a fatty liver. So age is not about for the fatty liver. So people can get at any age the fatty liver, and it is associated complications also.
Sir, sir, thank you very much for addressing all the queries and questions from the audience, and sparing your valuable time on Sunday evening, and explaining us on all the perils of non-alcoholic fatty liver disease and how we can overcome it, and we can live a healthy life with fatty liver.
So audio is not. It's okay.
So,
Am I
sir,
audible?
yes, sir, you are audible, sir.